Welcome, ladies and gentlemen, to your favorite time of the week. It's the Blue Star once a week Tuesday at 1:03 webinar to talk sales of telehealth and remote patient monitoring and chronic condition management and all that other stuff. Thank you for being here. I have 9 items to go over rapidly today, and then we can talk about whatever you want. So if you have any questions, as usual, write them down in the Q&A section at the bottom, and then we can talk about them for everybody. Some of the items I'm talking about today have come from questions through this past week where we've been talking to reps like yourselves, and I've said, yeah, that's a good thing that we ought to talk to everybody about. And forgive me if sometimes I repeat myself. There's an old adage in speaking. It says, tell them what you're going to tell them, and then tell them, and then tell them what you told them. And sometimes repetition is the key to making things sink in. And so forgive me if you are watching these webinars a lot. You may hear me say the same things often, but sometimes there's people that are only watching some of the webinars, and I want them to get the good information. So 9 items in no particular order. Item number 1, FCC COVID-19 telehealth grant. Google FCC COVID-19 telehealth grant. Basically, the federal government is giving money to organizations to establish community connections in broadband and other things to support telehealth. And it's all under the name of COVID, and it's probably somewhere in one of the COVID bills that were passed by Congress. But the FCC is giving money to organizations to go off and do telehealth. And it's the kind of thing that we do. It's $200 million total. I think they've given out 30 million in this latest batch, and there's about 40 or 50 recipients across the country. So those are some primary targets. You should look at that list. It's available on the web. And if you have any questions, you can talk to our rep coordinator, who is Alan Lanos, and Alan is his email is readily available to you. And if you don't have it, email me and I'll have Alan email you back. But the topic number 1 is think about the FCC COVID-19 telehealth grant, because it's a perfect fit for Blue Star services. Item number 2, you've heard this before, HRSA hypertension grant, HRSA hypertension grant. If you Google that, you'll learn everything there is to know about the HRSA hypertension grants. Right now, Blue Star is working with about a dozen recipients of this grant. There are 14,000 community health centers in America. About 1,500 of them are called FQHCs, federally qualified health centers, which means they get federal support. About 500 of those 1,500 got grants for hypertension remote monitoring. Those grants totaled about $100. The average grant is about $200,000 per institution. They are listed on the web at HRSA hypertension grant. That's your Google, and then you'll end up at a HRSA site. We have a list of all the grant recipients. All the grant recipients and the grant manager and his or her name and shoe size and email address and snail mail address and how much money they got, okay? So if you go to that website, you can see, oh, I live in New Mexico, and click on New Mexico, and it'll list all the people that got that in your state, along with how much money they got. Then go knock on their door and say, hi, I represent this very fine organization called BlueStar TeleHealth. They are helping 12 organizations like you execute on these grants. Can we help you? And if you do that, then we'll have our grant execution team kick into gear. Okay, so item 2, HRSA hypertension grants. Hopefully this is old hat to many of you, but if it's new hat, then go check it out. Item 3, remember that we want you to be openers, not closers. We're not asking you to sell telehealth or RPM or Blue Star or anything else like that. We're asking you to be an opener. It's not quite an appointment setter, but your goal is to get an organization, a physician's office, an FQHC, a hospital, to talk to Blue Star about implementing their programs. about figuring out how to do remote patient monitoring, figuring out how to do chronic condition management, figuring out how to reach out to senior populations. Because it's too hard for you to know everything there is to know. Heck, I'm the boss and I don't know everything there is to know. I'm constantly learning new stuff every day. And so we can't expect you to know all that. What you want to do is say, hey, BlueStar, they're a reputable company. They know what they're doing. They're doing this across the country. Would you like to spend 20 minutes in a Zoom call with this admiral who can give you more information? And you'll either get a yes or a no. So consider yourself an opener. Item 4, the basic pitch. I've said this 100 times. I apologize to those of you who have heard it before. You knock on a door, and when I say knock on a door, usually it's over the phone or in an email, or if you're lucky, it's on a Zoom or in person. And you just say, hey, are you folks doing remote patient monitoring? And if they say yes, say, how's it going? If they say no, say, well, RPM is, it's good for your patients, it's good for your practice, it's good for your pocketbook, PPP, patients, practice, pocketbook. Would you like to talk to this admiral on Zoom for 20 minutes? And he can give you all the information that you need to know in a 9-minute PowerPoint. I have a patented 9-minute PowerPoint that I probably gave 15 times last week. And it really is about 9 minutes. And some of you have heard me give it. And so that's your basic pitch. Do you have RPM? Yes or no? If yes, how's it going? If no, would you like to talk to these folks? PPP. Item 5, don't give too much detail and don't provide pricing, because we have a standard model of pricing. It's a kind of our retail pricing model for physicians' practices. But when you're talking to a hospital or an FQHC, if you drop those prices on them, it's just going to confuse them. And in some cases, it will put them off. We've had at least one instance in the past couple of weeks where a rep took our pricing sheet off of the web, a pricing that's intended for physicians' offices, and sent it to an FQHC. And then the FQHC called us up and said, hey, we don't want to deal with you. You're too expensive. And so I'm working hard to save that account by telling them that these were kind of retail physician practice prices. This is not what we would do for you because the scope of work is entirely different. So don't go into too much detail. Don't give people prices. Just say, hey, talk to the admiral and he can give you a basic sense of how this will work. And then and we can show them that it'll be cash flow positive. Item 6, exclusivity. We had a couple of people ask this week, hey, can I have Georgia as an exclusive? And the answer is no. The good news is no one else has an exclusive on a state. So if that person in Georgia knows somebody in Montana, then they can sell to that person in Montana. What we are, though, asking people to do is if you have accounts that you want to, that you're working and that you want to have registered with us, send that information to Alan in an email and say, Alan, I'm working this account. This is XYZ Hospital in Macon, Georgia, and please protect me for that. And we'll put you on the list and you'll be protected for that account. Don't send us 500 or even 100, but if you have a top 10 or 15 accounts that you're working and that you want to make sure that nobody else steals from you, then the best way to do that is to send that registration email to Alan. He'll take care of you. Number 7, website. We are making some changes to the BlueStarTelehealth.com/sales website. We're trying to do a better job of giving you the best version of the 25 different products that we have out there, lots of PowerPoints and videos and all that other stuff. And we're going to set up a matrix where you'll go to a single place and get the latest up-to-date piece of paper. So what you want to do is get into the habit of going to our website when you need the latest one sheet from BlueStar or when you need the latest presentation or something. Don't save it on your computer because it might sit there for 3 or 4 months and we might have changed it or updated it 5 times, and then you'll be sending out something that's old. More to follow on this, but I wanted to let you know that we're working hard on it. Number 9. I had 2 metaphors this week that I used in conversations with people, and they both said that they thought the metaphors were useful. And I went, okay, well, if they're useful to you, maybe I'll mention them to our incredible studio audience on the webinar, and you can use them if you see fit. And so my first metaphor, remember, I'm a nuclear and mechanical engineer. And so it was about the healthcare system. The American healthcare system has always paid when people got sick. It didn't pay to keep them well. It's a reactive, let's pay for a problem, even though it costs a lot of money. And my analogy was, I said, it's like if you buy a car and you have a service program on it, and they just wait until you drive it, and then the engine breaks because you never put any oil in it, and they replace the engine. That's one way to do it. But if you're providing the service policy, you'd be way better off just paying for oil changes, because then you never have to change the engine, or you have to change the engine far less frequently. And so for me, what I'm seeing and what we're all seeing is that the American healthcare system used to be just drive your car and, without oil changes, because we're not going to subsidize oil changes. But when your motor breaks, we'll replace it for tens of thousands of dollars. Now the healthcare system is slowly moving towards, you know what, we're going to pay for oil changes because we know that'll make your motor last longer. And RPM is part of that proactive rather than reactive, paying a penny to save a pound, as the British saying goes, okay? You can use an American, spend a penny to save $1. The other tortuous metaphor was, I was explaining to a rep yesterday, I said, this is a different kind of sale. And I've been a salesman, and sometimes you're selling someone and I don't know, they have a car and you want to convince them to sell their car and to buy a different car, or to buy a better car, or to buy a newer car. That's one thing. But if you're selling a car to a person that doesn't have a car, it's a separate situation. And I'm thinking back, RPM is new for most of the people you're going to be talking to. It's like in the early days of selling copy machines, Xerox used to be the big leader. And if you were a Xerox copy salesperson, you would just walk into an office and you'd be able to tell immediately if they had a copier. And if they had a copier, you'd walk out, but almost none of them would. And then you'd say, would you like to buy a copier? And you weren't trying to replace, a Canon with a Xerox. You were just saying, would you like a copier? It's cool and they really work. And those salespeople made a lot of money and they made a lot of sales because everybody wanted a copier. It was a cool thing. In RPM, our salespeople, when they're knocking on doors, are not finding that there's another XYZ RPM program already in place. They're not selling against competitors usually. They're selling against nothing. And so that's when you have to explain what RPM is and how it's cool, in the same way that the first Xerox copier salespeople had to explain what copy machines were and how they were much better than the other methods of using carbon paper and things like that at the time. Many of you on this call are probably too young to remember what carbon paper was, but if you Google it, they'll explain it. And then last item on the list is 8 steps to success. I'm going to very briefly share a screen, and we're going to do this 8-minute PowerPoint in 2 minutes. But just to refresh, this is up on the web, and there's also a webinar that describes this. Okay, item 1, get smart. Go to the webinars, go to the website, talk with me, read on Google. Okay, you don't have to be an expert, but you got to be smart. Number 2, pick your targets. We have some folks that have said, you know what, I'm going to do hospitals in Indiana, and they've been extremely successful. We have other folks that are on this call that said, you know what, I'm going to do doctor's offices on the south side of Chicago, and he's been extremely successful. Pick your targets and decide what you're going to go for. I talked to somebody this morning that says, I want to go after FQHCs in Florida. Great. It's a public list. Go get them. But I say pick your top 100 targets. Don't try to go for all 6,000 hospitals in America or all 100,000 physicians' offices. Then select how you're going to reach out to them. Are you going to drive up and knock on their door? Are you going to deliver brownies to get them to say hello to you? Are you going to do it on email? Are you going to Zoom? Figure out how you're going to communicate with them. Then have that very short opening conversation, the one that I just described to you. Do you have RPM? If so, how's it going? Okay. And then talk to anybody. Talk to the receptionist. Talk to the practice manager. Talk to any caregiver. You're not going to get to the decision maker the first time, but you can work your way up. And then what I've already said, sell the conversation with me. Don't try to really talk them into RPM. Talk them into spending 20 minutes on the phone to talk about RPM. And then follow up. It's going to take a lot of time and attention to get these people to give you the time and attention. Okay. And that's where the sales mentality comes in. When people say no, leave them alone because you're not going to change their mind. But when they say, I don't know, or I'm thinking about it, or call me later, then call them later. Sharpening the saw means make sure that you're paying attention to the art and the science of being a salesperson. Be disciplined, have a list, work the list. Someone said to me today, who was a very senior member of a billion-dollar organization, he says, plan the work and then work the plan. And then here's some examples. We have some reps that have been successful only with email, others with calling, others with contacts of people that they knew, others with direct mail, others with cupcakes, and then others with knocking on doors. Pick your methodology and then go do it. Okay. The journey of 1,000 miles starts with a single step. Okay. So that is the 4-minute item. And those were my 9 items. Okay. And it's 20 minutes after 1. Any questions or comments? I already told you about my mom being on Jeopardy, so I got to have something else to kill time other than talking about the Jeopardy theme song. My brother was on Jeopardy too, but unlike my mom, he did not become a 5-time champion. So there's that constant rift going on in our family. Okay, going once, going twice. Hey, we have success breaking out all over. There's my board over there, which is a copy of our CRM. We have 1, 2, 3, 4. We have about 10 accounts for which we have a signed letter of intent, and we're doing onboarding. We have a dozen accounts to which we have submitted letters of intent, and we are, working towards getting them to sign it. We have another half dozen accounts that all could be huge. We just haven't given them a letter of intent yet. Those are just the ones I keep track of on my board. In our electronic CRM, we probably have 60 or 70 prospects going on. Oh, one other item that I want to put a thumper on, and that is if you, Alan in our office is collecting names of prospects from reps like you that want to have people protected. So he sent out an email last week. If you didn't respond to the email, please do. If you're part of a rep network, they're probably being brought in at the rep network level. But if you're an individual rep, then get those names to Alan, and he'll make sure they're on the protected list. Of those accounts up there on the board, at least 7 of them represent $1 million a year in revenue to BlueStar. Okay, so do the math and figure out what that would mean to you as a rep. That's 7 out of the first, call it 20 that we've submitted an LOI to. So lots of opportunity out there. Lots of people are doing great work and having great accomplishments. So keep up the good work. Okay. And if you haven't gotten your first name up there on my board, then, talk to me and let's figure out a way to do it, because they're out there waiting, and they're waiting for someone like you to knock on the door and say, hey, are you doing RPM? And then take it from there. Okay. Thanks, gang. Have a great day. We'll see you next week.